morning, everyone, and welcome to our special update on FEMA's funding for COVID-19. I want to thank everyone for joining us this morning. I took a look at the registration list, and we have a great mix of attendees, lots of public entities, lots of hospital systems, lots of our consulting partners. So it's pretty clear that COVID-19 is still top of mind for everyone, and for good reason. We are just now beginning to see a lot of decisions come out of FEMA, a lot of the denials, a ton of RFIs. So we hope to share with you this morning a little bit of what we've learned over the last few years, and hopefully help the next few months and probably years, if you've been doing this as long as we have, go a little bit easier. So my name is Wendy Ellard. I am co-lead of Baker Donelson's Disaster Recovery and Government Services team. I've been doing this for too long now, over 16 years. My focus is disaster recovery with a specific emphasis on FEMA's program. And I have with me today Chris Baumhoff. Chris has been with our team for several years now. Before joining with us, he was actually on the other side working to support FEMA's implementation of the program. So we have a great variance of perspectives here. Together, we have over 25 years of experience in emergency management and disaster recovery, again, with a special focus on FEMA. So we're happy that you joined us today. I'm going to share first a couple of housekeeping tips. So we do have a Q&A box. This is a live webinar from our end, but you are not able to ask us live questions. You can enter them in this box, and we please hope that you will. We will do our best to monitor the questions and address as many as we can as we go. If we do not get to your question, we will reach out to you after and help you work through it, let you know what we think and what we're seeing. So also, we are a law firm, and I saw many attorneys on our list. We are attorneys. Chris is actually pretty close to becoming an attorney. So we have submitted this session for CLE credit. So if you are an attorney and you're interested in that, we have it confirmed for Tennessee, Florida, and Mississippi. If you're in another state, feel free to reach out to us, and we'll do what we can to get you that credit. You will see, if you're interested in that, some pop-ups come up throughout, just to make sure that you are actively listening. Make sure that you click those, and they should go away right away. And then finally, we're very interested in your feedback. We do these webinars a lot, and we want to know if there are specific issues that you'd like to hear more about, specific problems that you're having, totally different topics. Just let us know. And of course, if you have any feedback for the things that we've said, or just want to tell us your perspective, we're happy to hear it. Okay, so our focus today, of course, is COVID-19. This has been a very unique event. I was actually in Puerto Rico when it was declared, and I can tell you, when I arrived there, I had no thoughts of working under FEMA's program on COVID-19. Everybody in the industry was under the impression at the time that this would not be declared. So the Stafford Act has a definition of major disaster. And if you look at that definition, it includes natural catastrophes, your hurricanes, your tornadoes, fires, winds, floods. Pandemic is not listed, but there is a section of the Stafford Act. It's very far in the back. It's after all of the primary public assistance sections, Section 501. It actually does provide for authority to declare a emergency under Stafford Act for issues of a national significance, issues that impact national security, issues that our country as a whole are involved with. The specific section is titled Federal Primary Responsibility, and that is how FEMA was engaged in the COVID-19 pandemic recovery initially. We then saw every state and territory declared individually a major disaster, which opened up FEMA's program. Okay, so a primary basis for declaring COVID-19 as an emergency under the Stafford Act, and generally, was the fact that it impacted our nation's healthcare system. Of course, this was a matter of national security. This was a matter of extreme national significance. We were all really working together to respond to this event, to address this event, and to mitigate the continuing spread. So we first saw FEMA issue its very initial release in March of 2020. Following that, we saw FEMA open up its public assistance program. This allowed FEMA to provide funding for the first time on a national scale. It funded special measures that were intended to address the emergency situation, lots of healthcare projects, community-based testing sites. We eventually saw big drive-through vaccine centers, and of course, medical care. But as the program continued, FEMA, of course, saw many issues. This was an unprecedented recovery, and we began almost immediately to see special policies to address the types of things that FEMA would fund. One of the initial questions that FEMA had to work through was who could apply to the program. Under FEMA's usual program for emergency work, which all of the COVID-19 pandemic is, only public entities were eligible. The reason for that is that public entities are traditionally, historically, generally, the ones that have legal responsibility to protect the public health and safety. However, it was clear from almost immediately that, of course, there were many private nonprofit entities, particularly big health systems, that were going to be critical to the response to the pandemic. So FEMA issued guidance allowing these entities to apply to the public assistance program directly as applicants. This included hospitals, clinics, but also other types of entities as well. We saw schools applying for PPE, care, measures to continue education. We saw custodial care centers applying for measures that they had taken to keep their patients, their clients safe. One of the big questions we saw, and we've worked through it, but it's been difficult, is that we all saw shortages of PPE, shortages of staffing, and some of the entities that were actually providing the items, providing the staff, also wanted to apply to the program. So this was a difficult question because you do have to be responsible for the actual work. So something that we've grappled with there. You do have to be responsible for the actual eligible work, which we're going to talk about next. We also had some really interesting questions, particularly, again, with our health systems regarding who would be the eligible applicants. Many systems are set up with individual hospitals, individual entities, and subsidiaries. So that is something that we had to work through, again, with FEMA, something that really we had never had to deal with in the past. You know, typically if a hurricane impacts a facility, you're talking about one building, one hospital, or one geographic area at least. It's usually a pretty narrowly defined space. Here, we had multiple facilities across multiple states and even sometimes multiple FEMA regions. So lots of really interesting questions have come up in this event. So we then began to work, after we worked through FEMA's policies deciding who would be the eligible applicant, we began to see FEMA's guidance on how to apply, how these projects would actually be processed. And again, we're talking about a recovery effort on a national scale. More grant applications, far more than FEMA and the states had ever seen. So FEMA did require pretty early on that all project applications must be submitted and processed through its grants portal. Now, this was definitely something new, and again, a scale that no one had ever seen. So we've worked through that, and the system has changed many, many, many times. But if you are working on these claims, it is critical that you become familiar with the grants portal. Excuse me. And again, because many applicants are actually working in different states and sometimes different FEMA regions, it's very important to know the rules of engagement for the particular area that you're working in. Excuse me, it's kind of ironic that I'm coughing on a COVID-19 webinar. I don't have COVID, just a factor of living in Mississippi and having small children. But excuse me. So again, as we have worked through these claims, we have seen some differences. Some states have set individual deadlines, and some regions have set different policies. So always be sure, again, excuse me, always be sure that you understand the rules, the policies, and the people that you're dealing with for your specific area. Finally, we have some deadlines. Excuse me. The RPA deadline for this event was set at July 1st of 2022. That, of course, has long since passed. The regions had authority to extend that initially. Now, if you have not submitted an RPA, excuse me, you will have to work through FEMA's headquarters office. So as we have gotten farther and farther away from that initial deadline, we are seeing that it is more difficult. Next, as you are processing claims, know that there are two different timeframes that we have to be concerned with. Initially, costs are funded at a 100% federal share. That covers your costs from January 20th, 2020 through July 1st of 2022. The deadline to file those claims was actually the end of this past year. So if you had those early costs, again, you will have to work through an extension request. We do have several of these pending. It is possible to get an extension, but you will be required to show extenuating circumstances beyond your control to justify the extension. We're typically talking about new facilities, newly identified costs, things that you were not aware of at the time, but that have come up since the deadline passed. It can be very difficult, but it can be done. The next period of time is July 2nd, 2022 through the end of the incident period, which we now know is May 11th, 2023. If you have these costs, this grant period is still open. These costs are funded at a 90% federal share, and the deadline to file is November 7th, 2023. So we are quickly approaching that next deadline. And I can tell you that some states have set earlier deadlines to allow them time to review your claims and to help you through the process. So if you have these continuing costs, very important that you get your claims organized, get your costs reviewed, and pay very, very close attention to that deadline as we get closer and closer to the end of the project period. Now, the next phase, of course, is what costs are eligible. And I'm going to shift over to Chris to cover this section.
Thank you, Wendy, and good morning, everybody. So as Wendy just mentioned, lots of confusion early on, lots of different policies. So what actually is eligible under this disaster? And that's really been an evolving question throughout this process. As you see on the screen right now, early on, March 19th of 2020 was when FEMA released its initial fact sheet about what costs would be considered eligible. And as Wendy said, this was more geared towards public entities only and not healthcare organizations or other private nonprofit applicants. And so you see things like emergency operations center, security, distribution of food, water, ice, and other personal protective equipment. So early on, you know, the policies weren't really geared towards supporting healthcare systems and other types of PMPs. as Wendy was talking about the Stafford Act, the PAPPG, which is FEMA's document that has all of the policies applicable to COVID at the time it was declared, there is also no mention of pandemic in there either. So everybody was kind of learning about this as they move forward. And I wanted to address just one question we got prior to the webinar through the registration page was, did we see this process where applicants had to submit all their projects through grants portal through the streamlined application process? Has that led to more of a slowdown in FEMA's process, or has it been sort of as we see otherwise? And I think this early on, developing policy is one of the reasons why, applicants may see a little bit of slow progress early on with FEMA. Now, that's definitely not a national thing from our experience. Regions differ from one to another, and a lot of times that's out of the region's control. For example, one of the regions on the Gulf Coast is dealing with lots of hurricanes, flooding, other storms, whereas a different FEMA region may be able to only focus on COVID. So that's kind of a reason for some of the slow processing times we've seen. But also what we're hoping to kind of share with you all are some strategies we've seen when figuring out what these eligible costs are that have helped to streamline the process and help grants move through a bit quicker. So as you'll see on the screen, we have more of the earlier policies that were in effect at the time, talking about setting up temporary facilities when we were worried about the initial surges and how all of that was going to work, medical sheltering, and how we would deal with labor costs. However, in March of 2021 is when we got the medical care policy came out that really addressed what type of costs would be eligible for a lot of the healthcare systems that we're dealing with. And that's where we got into, PPE, medical supplies, testing, medications, all of those different costs that are needed to treat COVID patients, both suspected and confirmed, would be found eligible under the program. It also delineated a difference between, treatment of COVID patients in permanent facilities versus temporary facilities. One of the things we found is that utility bills and different things like that ended up being a lot higher because of the pandemic in the early days versus, earlier on. And FEMA started saying, they will provide funding for those wraparound costs, things like utilities and stuff like that for temporary facilities, but not necessarily for treatment in your permanent hospitals. So that's where the policies began to develop. And then later on in September of 21 was when the Biden administration issued their mandate to FEMA to create safe opening and operation procedures. And basically that allows, eligible schools, childcare facilities, healthcare facilities, as well as other private nonprofit facilities, as well as governmental facilities, claim costs that they need in order to safely reopen and operate. This would be things like testing patients, additional disinfection of facilities, handing out masks, enforcing social distancing, items like that. So those are the underlying policies that are still in effect. And we found that breaking up your claims into different kind of logical groupings is the best way to go about this to ensure that your claims can be processed smoothly. And so those different types of groupings are dealing first a project that deals with PPE, medical supplies, and some of your medical equipment groups well. Keeping these all in one area eliminates any reviews that have to do potentially with labor, issues with testing or other things like that. And we found has allowed things to move through a bit more smoothly. Keeping testing projects on their own has also been a strategy that's helped to keep the process moving. So typically our healthcare agencies or even some other entities that have instituted testing programs, they will either contract out their testing costs to a lab to perform all the testing, or they'll purchase tests and do their testing in-house. Either way, it eliminates review of any other types of issues that may come up, again, with labor or equipment or anything like that, and just allows FEMA to focus on one specific issue in that project, which we've seen has allowed projects to move quicker through the CRC. And finally, we found that segregating out labor costs into their own project has also helped. I'm sure a lot of folks on here, especially hospital systems, have submitted claims for the contract labor, contract nursing, and other medical providers that have helped you treat patients that were either suspected of having or confirmed of having COVID. And those projects seem to be taking the longest because just like FEMA didn't have any policies before March of 2020 about how to deal with the pandemic, most pay policies and labor policies for healthcare entities also didn't cover what would happen if there was a nationwide or a worldwide pandemic. And so squaring up FEMA's policy where, you know, you can only pay for either, you know, overtime, bonuses, hazard pay in accordance with pre-pandemic policies, or contract labor that had to do with directly treating COVID patients. We're now seeing that those types of projects are having more trouble going through because it's not really a great fit with the pre-pandemic policies that didn't anticipate this. So the first category of costs that we'll look at are PPE, supplies, and equipment that we talked about. Now, these are costs, again, like your masks, your gloves, your gowns, any medical supplies that you needed to treat patients, you know, including medications and things like that. And then also the equipment you may have either had to rent or purchase. This would be things like ventilators, you know, a lot of BiPAP machines, other respiratory supplies and equipment would fall into this category. And there's some considerations to remember when you're putting these projects together. You need to be able to show that it was a reasonable purchase, that it was required. You know, earlier on in the pandemic, this was pretty easy to do when there wasn't really, nobody really knew what was going on. There were surges occurring every few months. But just showing that, you know, based on the need at the time, you needed this equipment, this PPE, or whatever else it was in order to either mitigate the spread of COVID-19 or to treat patients in your facilities. Now, as many of you likely know, FEMA has issued a memo early on in the disaster saying that, you know, exigent and emergency circumstances existed for the entirety of the public health emergency related to COVID. And because of that, sole source procurement is an allowable method of procuring services during this time frame for this disaster. However, costs still do need to be reasonable for this disaster. So having a way to determine reasonable price, whether it be, you know, we looked into buying masks early in the pandemic and they were nowhere to be found and we had to purchase them, versus we used an pre-existing contract and just added on an amendment for additional services we need. Some way to show that the price that you were incurred for your PPE, your supplies, or equipment is reasonable is documentation to keep. And that gets into the third bullet point there about procurement. Also, something to keep in mind with PPE, supplies, and equipment is that FEMA does have disposition rules. This guidance was recently issued within the past 3 months, and it's different for equipment versus supplies. So if you purchased a ventilator, which is going to be over $5,000, FEMA is going to request that you do a disposition analysis now that the pandemic period is over. It ended on May 11th. And what FEMA is essentially asking is for you to determine what a fair market value is for that piece of equipment. Now, if the fair market value is above $5,000, FEMA will typically reduce your eligible funding by that amount. If it's under $5,000, FEMA won't reduce the eligible funding. However, there are some caveats to that. If you are continuing to use the piece of equipment for its original purpose, in this case, treating COVID patients, or if you are using that piece of equipment for another federally funded program or project, you won't need to go through this disposition process, and FEMA won't be taking that fair market value amount at this time until it's no longer used for one of those purposes. So it's still a bit up in the air what that means, how FEMA is going to treat that, since the incident period and the public health emergency did end on May 11th. However, that's something to keep in mind and something to make sure you communicate with FEMA that you are continuing to use these items if you do receive an RFI about disposition for your equipment, which we have seen starting to go out in the past couple of weeks. The similar rules apply for your supplies. So, for example, if you have $300,000 worth of masks that you purchased early in the pandemic, but you never ended up using, FEMA will also look for a fair market value amount to reduce the funding by for those items. FEMA looks at the aggregate of supplies. So for masks, it would be the aggregate of your unused supplies, that for your unused masks, and that's what FEMA would look to deobligate as a salvage value. And so in those instances, you need to look into, well, was the item expired? As we all now likely know, masks do expire. And if they expire, FEMA will not require you to provide that fair market value per this new guidance, as long as you can demonstrate that the item did expire. So making sure you keep those records on hand and make sure you inform FEMA of that is essential to make sure that you comply with the disposition requirements. And with that, I'll turn it back over to Wendy to talk about our next category, which is labor costs.
Thank you, Chris. And thank y'all for bearing with me as I struggled through the deadlines slide there at the end. We actually have a really great question submitted, so I wanted to cover that quickly. And the question is whether that November 7th, 2023 project submission deadline applies to management cost. What I mean by management cost is that FEMA has realized that its program is incredibly complex and difficult, and it takes a lot of time to comply with all of these documentation requirements. So applicants are eligible for up to 5% as an add-on in additional funding, and the 5% is calculated based on your otherwise eligible cost. That funding can be used to cover your actual cost incurred for management cost. That can be cost of contractors, that can be cost of your internal staff, as long as you document the time that these individuals are spending on the FEMA claims, meeting with FEMA, talking with FEMA, preparing the documentation, preparing and filing the claims. So there is a little bit of relief there in terms of working through the program. FEMA has said as of right now that you can continue incurring management costs through 2025, May 11th of 2025. That is our current cutoff for incurring these costs. FEMA has not yet set a specific deadline to file management cost claims, but that deadline is typically set based on the date that your other eligible projects are closed. So keep in mind, when you file those claims in November, of course, you're going to still get questions from FEMA. You're going to get RFIs. You're going to have to continue through the process, really see it through. So, of course, you're going to incur additional costs beyond November of this year. FEMA realizes that, has acknowledged that. Continue tracking those costs, but be ready to support your actual incurred costs on that management cost claim. Okay, so moving forward to the next big category of specific claims, labor cost. For most of the entities that we have worked with, the biggest claim category has been labor. This has been a very unique event. It has taxed every entity to the fullest, including FEMA and the states. And so labor costs are a big part of the claims. So a cornerstone of FEMA's program is that the funding is there to cover costs you have incurred related to the declared event. Only the costs related to the event that you would not have incurred but for the emergency circumstances. That's very, very important, and that really is the underlying reason for a lot of the labor cost policies. But as Chris mentioned when he was talking through the costs initially, a lot of FEMA's policies were in place before COVID. And so they're very hard to apply to these claims. They might seem a little bit nonsensical, a little bit unreasonable, but for now, we have to work through what we have. We have to address FEMA's questions, and we have to at least do everything we can to make sure that our claims are in line with FEMA's standard labor policy guidance. So for emergency work, so like I said, all of the claims under COVID are considered emergency work. Only overtime labor for your internal staff or force account staff is eligible under these claims. Now, there is a very specific point here. The overtime labor is eligible for your budgeted employee hours. Any additional staff that you hire specifically to work on COVID-19 matters can be eligible. Any overtime hours that your staff work can be eligible. Any essential employees that you furlough and call back to work specifically on COVID can be eligible. We're talking about things, costs, labor hours that you have incurred specifically related to this event that you would not have incurred otherwise. We have gotten into some really, really specific, really detailed analysis regarding the chart that you see on your screen now. This chart is pulled from FEMA's PAPPG, the standard guidance document, but it is being applied to COVID-19. So again, some of these things have gotten pretty tricky. One of the biggest issues that we have seen is in dealing with overtime and premium pay, especially for some of our large public entity applicants and double especially for all of our hospital clients. We have had issues with FEMA's standard policy on payment of overtime and premium pay. So FEMA's usual policy will limit eligibility for overtime and premium pay to what you would have incurred under your pre-event pay policies. Therein lies the problem. Nearly everyone is having issues with this because no one had envisioned that our world would be impacted by a pandemic the size and scale of COVID. So we saw huge struggles, especially with healthcare labor. Staff were out because they had COVID. Staff were out because they were quarantined. Staff were out because they were leaving to work across the country as a contractor. That, of course, necessitated paying internal staff more to absorb the risk of COVID, more to absorb the additional hours required, the additional strain and emotional toll that the COVID pandemic took. But for now, FEMA is still applying this pre-event policy to eligibility reviews. So what does the policy say? What is required? First, FEMA is going to ask for a copy of your pre-event policy. Many entities had existing pay policies in place, but they did not necessarily mention pandemic. We are looking at those pre-event policies to at least explain to FEMA what you would have paid. And oftentimes that is not equal to the full actual cost incurred. We are trying to work with our applicants to at least get the claims up as high as possible to cover as much of your costs as possible. It can be very helpful to demonstrate to FEMA that you have applied this policy previously during times of normal events that have taxed your staffing resources, during times perhaps of extreme flu outbreaks, extreme strep outbreaks, extreme community events that may have required extra overtime of your police force, things like that. Even if you are paying overtime and premium pay in a bit different way than appears required under your policy, sometimes if you can demonstrate to FEMA that you really are paying your staff consistent with your pre-event practice, that can favorably support your claim. This is definitely one of the issues that we are seeing handled differently across regions, differently across some areas of the country. So it really is a case-by-case review. Everyone's pay policy is a bit different. Everyone's situation is a bit different. So this is truly an example of a time when it definitely is to your benefit to work with your state contacts, work with your assigned FEMA personnel, and try your best to cooperate and coordinate on a response, an answer that can at least provide some relief, some financial resources for your situation. All right, another big aspect of the labor claims is contract labor. As Chris said, we have seen this especially prevalent in our healthcare entities. Oftentimes when staff were out, as I said, either traveling as part of a contract team or out because of required quarantine or sickness, family illnesses and things, there were extreme needs to bring in additional staff, contract labor. FEMA's usual practice is to pay the full cost of contract labor, straight time, overtime, even traveling expenses when it is covered by your contract. But note that for these contract labor claims, you will be required to submit the same type of documentation that Chris mentioned for your ordinary contract costs. You will be asked for copies of the contracts, copies of your invoices, and copies of pricing sheets. One issue that we have seen, especially on the large contract labor claims for health systems, is that there have been variations in pricing. We all know that the market has been taxed, and we have faced, one of the normal topics that we see in economics, supply and demand, right? There was a limited supply and a huge demand for these contract medical staff. So the price has gone up. And at times we have seen a little bit of a lax documentation of that increased pricing. So you need to make sure that you have some type of contract amendment, even if it's something signed after the fact, to confirm the pricing that you paid. We have also seen questions, again, in some regions about the reasonableness of the cost. So make sure that you are documenting why you have paid these increased prices. Oftentimes we have been able to show surge rates with the graphs that many of the state departments of health have kept. We have been able to show bed counts. Here are my normal staffing ratios. Here are my actual patient counts during COVID. I absolutely had to pay these contract laborers at these rates, or I would not have been able to properly operate my facility. We have actually seen FEMA be fairly reasonable in reviewing the pricing for these contract labor claims. And then you may be asked to document procurement. As Chris said, one of the first policy documents that FEMA issued for the COVID-19 event was a memo on procurement, describing the type of review that FEMA would apply to these emergency procurements, these staffing contracts. But we are still seeing some regions ask for that documentation. So if you are asked about that, know that that memo is out there. And again, be prepared just to demonstrate the emergency nature of your specific situation. All right, now finally, one of the issues that we have seen pop up across multiple regions very recently is a requirement to document that laborers were working on COVID-19 patients. As I mentioned in the initial section, there are essentially two time frames of claims in this event. We had the initial period of 100% federal share payment through July 1st of 2022, and we now have these follow-on claims from July 2nd, 2022 until May 11th of 2023. Early on, when the world was crazy and we were all just trying to survive, we saw FEMA apply almost a presumption that these additional staff members were working on COVID-19 patients. They were really working, in the trenches to care for these critically ill people in your facilities. Now that we have moved a little bit farther out from those critical time frames, we are seeing FEMA take a little bit more of a reduced view of eligibility. Sorry about that. Something about this transition period makes me start coughing each time. So some of the strategies that we have used to document that these eligible laborers were working on COVID-19 patients or are otherwise sufficiently related to the eligible event to justify FEMA payment are, of course, to provide time cards, timesheets, specific records if you have them. If you are able to show that the specific member of your medical team or the specific member of your public safety workforce was working on a specific COVID-related task, fantastic. If you set up a specific COVID-19 ward or wing or rooms, fabulous. But I will tell you, if you did that, you are among the few. Most entities are having to resort to a little bit more creative strategy in order to document eligibility of these labor claims. Excuse me. For health entities specifically, one of the options that we are working through and that we are seeing some success with is to document your patient ratios. FEMA has asked for data on your patient counts before COVID with a comparison to your patient counts after. Show us the type of labor cost you incurred before the event, the type of labor cost you're incurring now. And as long as the ratios match up, as long as the time frames match up, we are seeing some favorable response from FEMA. Again, it's differing per region, but FEMA does seem to really want to work with us on these claims, and that's refreshing to see. We are also seeing some success with demonstrating the different types of care provided. If you have some specific departments, respiratory care, for example, that are still presumed as dedicated at a high rate to caring for COVID-19 patients, we are seeing a better return on those types of calls, just again, because everyone now understands the care required for a COVID-19 patient and what types of staff members are going to be needed. Just know that as we get further and further away from that critical response time frame, we are seeing FEMA ask for more and more documentation. So especially as you're working to prepare claims for the current time frame, you may be asked for more information. And if you're still incurring these costs actively and documenting these, working within your system, it's a great idea to ask for as much documentation as you can from your HR department, from your contractors, while this is pretty fresh on everyone's mind. A couple of the other major issues that we're seeing for labor costs are backfill options. FEMA's normal public assistance program does recognize that at times you may pull staff. You may pull your usual staff. You may pull an RN that had been working the front desk, for example, and send him or her into the trenches because there was just that critical need. If you hire a contractor to answer the phones at the front desk, for example, you can claim the time for that backfilled person. Again, because that is a special cost that you're incurring. It's specifically related to the event. That person, while answering your front desk phones, would not ordinarily be eligible. They are allowing for that RN to step into eligible work. So as long as you can document who they are backfilling for and that is eligible work, you can get some of those costs funded. Reassigned staff is another one that we are seeing quite often. You have to be careful with that to ensure that they are documented as performing eligible work. Excuse me, I'm so sorry. And then finally, increased operating costs. That is a major eligibility issue. Again, especially as we are getting into these later time frames, something to be aware of. And now I will shift back to Chris to close us out with duplication benefits.
Thanks, Wendy. And just real quick before we move on from forced account labor, we did have a question where somebody received a determination memo for their forced account labor claim, and they're wondering if they're allowed to provide additional information as part of their first appeal. And absolutely you can. If you have additional documentation that helps address some of the issues that FEMA brought up in its determination memo for why your claim was denied, bring that forward in the first appeal. There is no, you're not limited to only the documentation you've already provided. So if you have additional information that helps tell the story of why you believe it's eligible and why FEMA's determinations are wrong, absolutely include that in your first appeals. So moving on to our last issue for this webinar is duplication of benefits. And from my experience, this seems to be FEMA's primary issue that it's trying to tackle at this time. As you all know, in traditional hurricanes, tornadoes, things like that, figuring out duplication of benefits isn't terribly difficult because it typically revolves around insurance policies and what you would anticipate to get under that policy and what you actually get under that policy. Here in COVID, with our medical systems, it's a whole new animal dealing with patient care revenue, where you may have self-pay, you may have pay through Medicare and Medicaid, private insurance, other COVID relief funding, and FEMA's had difficulty wrapping around exactly how to address the prohibition on providing funding for work that was covered from another source. And so there's been multiple iterations, again, of policies about this going through, which you can see on the screen now. But in October of 2022, FEMA issued its current duplication of benefits policy. And in that policy, FEMA recognizes, the costs that are being claimed in these FEMA projects, the way that medical billing occurs is not really broken down into these same types of components. However, they do still contribute to the same type of service, which in this case, we're typically talking about, treatment of suspected and confirmed COVID patients. So in order to address these patient care revenue duplications, the Department of Homeland Security contracted with the RAND Corporation in order to develop a methodology just to figure out, hey, how can we find some way to address any potential duplications with patient care revenue? Now, one of the reasons why I say that this seems to be a priority for FEMA right now is you or any applicants that you may be working for likely have received an RFI in the past couple of months, or may have one coming in the next few weeks and months, asking you to determine what your duplication with patient care revenue is for your claimed projects. And these RFIs are typically all structured in the same way. It'll give you 3 options for how to do it. The first option is an applicant can provide their own methodology for how to determine if there was a duplication with patient care revenue. Pretty open-ended and not a lot of guidance on how to do that. The second is to allow FEMA to determine what the patient care revenue duplication is using publicly available data. And typically where FEMA is pulling that data from is the EMA system, the electronic municipal market analysis system, where a lot of yearly audited financials are uploaded for hospital systems. They're pulling those numbers and determining what they believe would be a potential duplication with patient care revenue from there. And then the third option is for an applicant to provide additional financial information to FEMA and allow FEMA to figure out where the potential duplication is from there. Missing from these RFIs is really an idea of, how does FEMA do this? How are we supposed to tackle this issue? Like they say in their guidance, medical billing doesn't conform to how these FEMA projects are structured. And so what we want to do here in these last 10 minutes of this webinar is walk through an example of how FEMA has gone about creating estimates of what these patient care revenue is and how you can use that in order to determine what a potential duplication should be for your projects, if any. And so moving forward here, if you don't like math, this can be a horrifying slide, but I promise this is actually a pretty simple project for how FEMA goes about this. So what FEMA is essentially doing is they're determining, using your 2019 audited financials, basically the year before the pandemic, they're determining what percentage of your patient care revenue would be expected to pay for kind of those categories of costs that we talked about before, for your labor, for your medical supplies, for your equipment. And by determining that, they're calculating what they call an allowable ceiling for what FEMA will fund there. And we'll get a little bit more into that as we walk through this example here. So first, I want to note off the top that, you all may have received some duplication of benefits RFIs about a year ago that were a little less specific. And a lot of entities were responding to these saying, we track our COVID costs to different cost centers. We haven't received any private insurance, Medicare, Medicaid, private payments for these costs. Therefore, based on our internal tracking system, we don't have a duplication. And that pretty much went through. But currently, with this new RAND review process, it's quite clear that you need to provide financial documentation behind your analysis in order to support your position on what your duplication of benefits amount should be. So on the screen here is a sample of an audited financial statement here. You can see up top we have our net patient service revenue amounts, and then down here are the expenses that kind of fall into those categories of what we see a lot of the FEMA projects containing. So we have salaries, wages, employee benefits, contract labor, medical supplies, and we have our 2019 versus 2020 values here in order to show how we calculate the pre-pandemic baseline amount, and then how FEMA is using that in order to determine what they believe any potential duplication with patient care revenue would be. So using these audited financials, step one is to determine that pre-pandemic ratio of labor cost to patient care revenue. And in this example, I'm going through labor, but you can do this the same for your medical supplies, for your equipment, or any other items that you may have included in your FEMA claims. And so based on the audited financials from the previous slide, this hypothetical applicant had $493 million in 2019 labor expenses compared to $750 million of patient care revenue in 2019. And so creating this ratio determines that 65.73% of the patient care revenue pre-pandemic was used to pay for labor expenses. And so FEMA is now going to use this pre-pandemic percentage to say, well, how much labor would we expect your patient care revenue to pay for in 2020, 2021, and 2022? And here's how we go about doing that. So from that initial slide with the audited financials, the patient care revenue in 2020 went up $50 million and was at $800,000. Now, what we do is we multiply that amount by that pre-pandemic labor ratio that we derived on the previous page, the 65.73%. And this leaves us with $525.8 million that FEMA considers patient care revenue that would be attributable to 2020 labor expenses. So essentially what FEMA is saying is your first $525.8 million of labor revenue in the first pandemic year, 2020, we would expect you to have incurred those costs regardless of the pandemic based on your pre-pandemic ratio. So therefore, that first amount is something that would not be eligible under public assistance because it would be a duplication of benefits. So moving on to step three, we then determine what would be the allowable ceiling for 2020 labor expenses. Basically, how much funding, what is the maximum amount of funding that FEMA would provide for your labor expenses in 2020? So per that audited financial, again, in 2020, there were actual labor expenses of $546 million. We subtract out that baseline amount, the $525.8 million that we calculated on the previous slide. That would be patient care revenue attributable to 2020 labor expenses. And that leaves us here with $20.1 million of what FEMA is calling the allowable ceiling for 2020 labor expenses. Basically, this means If you submitted a project for $15 million in labor expenses and they were determined eligible through the process, FEMA would find that there was no potential duplication of benefits with patient care revenue in 2020 based on this calculation, and that entire claim, your entire $15 million claim, would be able to move towards obligation. Now, on the flip side, let's say you only had $500 million in actual labor expenses in 2020. This would then be a negative number, your allowable ceiling. In that instance, regardless of how much labor you submitted to FEMA for work that was performed in 2020, FEMA would say, no, you would have been expected to incur that $525.8 million in 2020. Therefore, we can't provide any funding because we consider that to be a potential duplication with patient care revenues. And again, I realize this is a lot of math over multiple slides. So if any of that didn't make sense, please leave a comment and we can reach out afterwards to go through that again. But that's the basic formula for what FEMA uses in order to determine its patient care revenue potential duplication of benefits for your FEMA projects. So going through here, there's a couple strategies that you need in order to address your duplication of benefits if you want to provide your own analyses. First, you want to make sure that you use actual financial data. Again, like I said, conclusory statements just aren't going to cut it. FEMA's going to want to see the documentation in the backup to say, hey, this is what we paid pre-pandemic, this is what we paid post-pandemic, and we believe that the excess is all attributable to COVID. We need to be able to point back to actual financial data in order to do that. Another issue that you want to look into when looking at what your potential duplication is that FEMA considers some items that are almost certainly included in your claims as low risk and thus don't have to go through this duplication analysis process. And so this is from the duplication of benefits memo, and you can see items like PPE, non-medical supplies for facility modifications. So example, if you did minor modifications to create negative pressure rooms, air disinfection, testing of your employees, setting up physical barriers like sneeze guards. These are items that FEMA considers very low risk to be duplicated by patient care revenue, and thus those can be removed from your analysis. And the effect that this has is, let's say, according to FEMA's process, you have you submitted $1 million more in your PPE project than what FEMA would have as its allowable ceiling. So it considers that extra $1 million to be a duplication. Well, what this allows you to do is you can strip out all the PPE, sneeze guards, everything like that from your project to lower the amount that goes into your calculation and hopefully drive your actual cost claimed below the allowable ceiling in order to reduce the amount that would be duplicated by patient care revenues. Similarly, and we're running short on time, but we want to ensure that when FEMA analyzes your financial data, that you're properly telling the story of what that financial data is. And so, for example, what I mean by that is we've looked at a lot of different hospitals' financial data, and none of them tell the exact same story. So, for example, if you have a testing project, are your testing costs included in a medical supplies expense in your financial report? Is it in purchase services? Is it in both? Because where those costs actually lie in your financial report will affect that calculation that we just went through. And so you want to make sure that the comparison when you're doing this analysis is apples to apples. Similarly, when you're looking at labor costs, you may be claiming force account labor versus contract labor. If you look at everything as a total, it may not tell the true story of what your costs actually were, because as we know, contract labor costs skyrocketed. So it may make more sense to drill down into your financial data and say, well, let's actually compare our pre-pandemic contract labor spend versus our post-pandemic contract labor spend, stripped of your force account costs, in order to have a true apples to apples comparison that may assist you in this duplication of benefits analysis. So those are the types of things that you want to look into for doing a duplication analysis. Like I said, it's a relatively simple calculation, and you just want to make sure that the calculation tells the true story of what's in your financial data so that you can accurately characterize what costs were spent pre-pandemic versus what were spent post-pandemic in order to get a more accurate determination of what a potential duplication with patient care revenue may be. And with that, I will turn it back over to Wendy.
Hi, everyone. Thanks so much. I know we covered a lot today, and these claims are super complex. We have a lot of great questions, which I think indicates that this webinar was timely, and we may have to do an update. If we answered your question, or if you have additional questions or want to follow up with us on any of the topics covered, please feel free to reach out. We do have these types of webinars quite often, and we also try to issue big updates via our sites and our email list. So reach out to us if you don't think you're getting those updates. We can add you to the list. And again, thank you so much for joining us today.